This is my audience. Hello, my name is Alexis Cooper, and today I'm going to inform you about diabetes. How many of you know someone with diabetes? All of you raised your hand. Approximately 26 million people in the United States have diabetes, 79 million people have prediabetes, and an astonishing 7 million people are undiagnosed. There are a lot of myths that are asked about every day about diabetes. For example, some people say diabetes is not that serious of a disease. If people manage their diabetes properly, however, they can prevent or delay complications. And diabetes causes more deaths a year than breast cancer and AIDS combined, and 2 out of 3 people with diabetes die from heart disease or stroke. As an exercise science major, not only have I studied the benefits of exercise on non-disease populations, but also diseased populations as well, such as diabetes. Exercise can be used to help manage diabetes, improve insulin resistance, lower risks of cardiovascular disease, help the body use insulin better, and this helps control blood sugar, and it offers many other benefits. With the simple fact that 7 million people are undiagnosed with diabetes, this raises an awareness. We as a nation need to take a more proactive approach to be aware of signs and symptoms to see if we are at risk. My goal this evening is to inform you about what exactly diabetes is, signs and symptoms to be aware of, prevention strategies, and how this disease is treated. Approximately 26 million people in the United States have diabetes. What exactly is diabetes, we may ask? Diabetes is a group of metabolic diseases characterized by the inability to produce sufficient amounts of insulin and or to use it properly. Type 1 diabetes, also known as juvenile onset or insulin-dependent diabetes, is accounted for 5 to 10% of the cases and is considered an autoimmune disease in which the immune system attacks the body's own beta cells, resulting in a deficiency of insulin. As a solution, insulin must be injected. Type 2 diabetes is also known as adult onset or non-insulin independent diabetes and is the most common form of the disease and approximately affects 90 to 95% of the cases. This disease usually occurs after the age of 40, however, it has been increasingly seen in younger adults. Type 2 diabetes is when the body's blood sugar levels rise higher than normal because the body cannot use insulin properly, and this is called insulin resistance. First, your pancreas will make extra insulin to make up for it, but over time it is not able to keep going and make enough insulin, and this is what keeps your blood sugar high. This disease is progressive over time. Another type of diabetes is gestational diabetes, and this occurs in 2 to 10% of pregnancies and is usually diagnosed during the pregnancy by an oral glucose tolerance test. Risk factors for developing this include family history, a previous delivery of an overweight baby, and this would be considered over 9 pounds, and obesity is also a risk factor. Even though glucose tolerance returns to normal after pregnancy, women who have had gestational diabetes during their pregnancy, after they're at a 35 to 60% increased chance of developing type 2 diabetes in the next 10 to 20 years, so they have to be really careful in prevention strategies so that doesn't happen. When we think of complications dealing with diabetes, they are categorized as acute and chronic problems. And this would be considered as hyperglycemia or hypoglycemia. Hyperglycemia, or high blood sugar, happens when diabetes is out of control and blood sugar gets so high that it causes the kidneys to excrete glucose and water, causing increased urine production and dehydration. This can also cause a headache, weakness, and fatigue. Hypoglycemia, also known as insulin shock and insulin reaction, is a side effect of diabetes treatment, and glucose levels drop below 60 and 70, which is the normal level, and below normal. This shock can happen if there is too much insulin, too little carb intake, missed meals, excessive or poorly planned exercise. As for chronic complications, diabetes is the leading cause of onset blindness, lower limb amputation, and renal failure. Diabetes is a risk for microvascular disease, and this is a chronic complication happens when there's a blockage of the blood vessels to the heart, brain, and lower extremities. Microvascular disease causes retinopathy and neuropathy, which results in abnormal function and damage to the small vessels of the eyes and the kidneys. Retinopathy is the most damaging and can cause blindness and renal failure. To be more informed about diabetes, we need to be more aware of the signs and symptoms. Polydipsia is the feeling of excessive thirst, while polyuria is the need to urinate frequently. And these are the most seen symptoms in diabetics. Other symptoms may be unexplained weight loss, infections and cuts that are slow to heal, blurred vision, and fatigue. Many type 1 diabetics have some or all of these symptoms, while some type 2 diabetics may remain asymptomatic, which causes a fourth of those with diabetes to not even know they have the disease. To me, exercise is medicine, and most people with diabetes can strongly benefit from participating in regular exercise. When you're active, your cells become more sensitive to insulin, so it can work more efficiently and remove glucose from the blood. Exercising consistently can lower your blood glucose, which allows the person to take fewer diabetes pills or less insulin. Regular exercise is important to diabetics because 2 out of 3 diabetics die from a stroke or cardiovascular disease. Therefore, if precaution is taken and regular exercise is administered, the risk for these diseases are lowered. Medical nutrition therapy is also another form of help in prevention. It is the self-monitoring of blood glucose, diabetes education, and medication. Eating well can lower your risk for type 2 diabetes and heart disease and can be managed with time and dedication. This goes for eating a lot of foods rich in whole grains, fresh vegetables, leaner meats, less or no soda, and also low-fat dairy products. In conclusion, living with this illness possesses special issues. Diabetes management requires ongoing dedication. A balance of regular exercise and healthy eating habits should be an essential component of the treatment plan for diabetics because it can improve blood glucose control, lipid levels, blood pressure, body weight, and has the potential to reduce the burden of this metabolic disease. If we can raise more awareness about diabetes, one day we may be able to find the cure for it and also improve the lives of all the people affected by it. Thank you.